This is our update to the community once again, and we'll hand it over to you, President Eklund.
All right, good morning, everybody. Thank you all for coming out. Welcome to our community COVID update. Nathan Brown had some other business to attend to this morning, so I am here in his place. And so I think we will start off with an update with Caroline Stumpo, Orillia Soldiers Memorial Hospital.
Thanks, Bill, and thanks to the Chamber for hosting this. I've not always been the bearer of good news in these meetings, and it's a little bit better this time around. So I'll start with some of the numbers just to give people some context, and I'll go into where we are at as a hospital and as a region. So I think everyone's seeing the dramatic decline in numbers. The last few days, we've been hovering around 360, 370 new cases in the province, with a very low positivity, 1.3%. That means we're not missing cases due to lack of testing. So that is a great thing to see. Hospitalized patients is dropping slowly. We're just under 400 hospitalized patients, which is better than we were at 2,300 several months ago. Our ICU is also dropping at 352. That is the slowest one to drop. The recovery for COVID positive ICU patients is very prolonged. So everything's moving in the right direction overall numbers wise, and that's true in Simcoe as well. New cases in the county have hovered between 6 and 12 per day. That is far reduced from our peaks in wave 3. And in hospital, we still have 20 patients. However, that number also is declining slowly. So when you look at volumes, look at cases, everything's moving in the right direction except for the Delta variant. And I want to spend a little bit of time talking about that. We know in the province, the Delta variant is starting to pop up in specific areas. Kitchener-Waterloo is a great example. The other day in the report, Kitchener had more cases in total than Toronto or Peel. That hasn't happened in this pandemic before. And it's attributed to outbreaks in congregate settings in Kitchener that translated to increase in hospitalization. So this is real impact, and we are seeing it more and more. We have 18 cases in the region. That was enough to qualify us, Simcoe, Muskoka, as a Delta region, accelerating the second dose. And the reason for that, the Delta variant, with the current vaccines we have, there's 30% efficacy with a single dose. It goes up to about 90% efficacy with a double dose. So we keep entering new races. So we started with a race to the first dose, and that was incredibly effective for most variants. And now we have a new race, a race to a second dose. And in the province, we have great, as a country, I think we're leading the world in first dose access, which is phenomenal. And that was the strategy, and it made a lot of sense at the time. Now we need to change gears and have a second dose strategy. And that's where we're moving towards. And it's directly related to the Delta variant. So that is sort of the case number updates, and the second dose strategy is supported by a variety of different ways that we are getting vaccines out under the leadership of public health with the support of a variety of different agencies. And it's the the Couchiching Ontario Health Team partners that have really played a huge role in having access to clinics, the Rotary Place, pop-up clinics. We've had them now in Ramera, we've had them in Coldwater. We've also had outreach to long-term care facilities, retirement homes, and other settings, homebound individuals. So that is our way out, and we continue to put a lot of energy into that. The supply of vaccine is increasing. The guidelines are changing daily, hourly, and we're trying to stay on top of that. So as a hospital, I'll close. We are incredibly busy right now, not necessarily with COVID. We have no active COVID patients. We do have some recovering. We do have a few patients that are very slowly recovering in ICU from the GTA, but we are making progress. We are seeing improvements there. So it hasn't been the COVID burden. It's been a factor of several things. One, we have restarted surgeries. That is day surgery, inpatient surgery. We're not at 100%, but normally we have a reduced schedule in the summer, and that's what we're working towards is our typical summer schedule to get up to speed and get the ORs going with plans to accelerate as quickly as we can. At the same time, we are seeing, well, let me stay with surgery. Our backlog is hundreds of cases. So we require patience for people. The offices will call. However, we do have a plan.
Interesting.
We do have a plan, and we're working through that for the operating room. The other thing that's really happening as well is the emergency department has gotten incredibly busy for two reasons. One, we know people have deferred care needs, whether by choice or by access. They have not gotten the care they needed, and people are having some great difficulty, and the acuity is going up. So we're seeing people come into hospital more sick than average and more people getting admitted. So our hospital is every bed. We have 35 extra beds in our facility open for COVID. Even though there's not a single active COVID patient, every bed is full and then some. So we are seeing that growth in the deferred care, and we're also talking to our emerge staff at triage. They are triaging more and more people moving, visiting, coming from all areas of the province. So the phenomenon we're seeing in the real estate markets, on the highways, is absolutely being seen in the hospital, and that's creating more service need. And we're used to the seasonal variation. That's not new. However, it's not just seasonal anymore. People are making decisions about where they stay for much, much longer periods of time. It's not just weekend work, it's all week work. So it's having significant impact. So that's where we're at. Overall, it's going to take us the summer to recover. I think our staff are exhausted. We're finding that staff aren't even picking up overtime shifts anymore. They don't care about the money. They don't care about coming in. They care about their job. They care about their patients, and they care about themselves. So they want a little bit of time to themselves, and you can't blame them for that. So what we're finding now is, since the immediate pressures are gone, they were really putting in time above and beyond, and we're actually asking them to take a little bit of time for themselves. They need it. So we are going to pace ourselves in the way over the summer to allow some of that to happen and create a bit of patience there. But make no mistake, coming into the fall, we hope with a solid vaccination strategy in our community that we can hit the ground running and be back to the days where we were at 120, 130% capacity, making up for lost time in our ORs and running our emerges and ICUs as we normally would. So that is our planning in a nutshell, and a sort of look at COVID in the city and in the province, and I'm happy to take any questions.
I have a question.
Oh, Judith?
Yeah. Carmen, what is the difference with this Delta variant? Is it like a stronger one, or is it like, you know what I mean? Like,
Yeah. The variants all have mutations, and the mutations confer different options. So the Delta variant has a couple of distinguishing features. So Delta variant is more transmissible. So it's more contagious, and it lands you in the hospital. If you recall, when we saw the new Alpha variant, which was the one that originated from the UK, we call it the UK variant, that one came with about a 30 to 40% higher transmissibility and hospitalization. The Delta variant has sort of stepped that up again, another 40, 50, 60% transmission and likelihood for, well, the transmission is the part. We know it's more highly transmissible. The other factor is the amount of immune exposure you need to mount a response. So the single dose, 30% efficacy versus 90% efficacy for the two doses. And that is just a function of recognition of the virus and being able to mount an immune response. The good news is the viruses still work. You just have to prime the system more. It requires 2 exposures, not 1. So those are the key differences that we see. And the whole idea of stomping out all virus, that's the best way to prevent I think we already have an epsilon, and they use sort of the Greek alphabet to start naming these viruses. There could be more, and we just keep chasing after mutations, which are going to occur.
So supplemental to that, then we basically are looking at possible, as you say, other variants, but possible, well, I mean, it's probable that this vaccination will be like our flu one, but it isn't, you choose to, you should take it.
Oh, the vaccine, whatever we can do. The other element that the Delta variant has shown, because it's more transmissible, the concept of herd immunity changes. So when you have a less transmissible virus, you don't need as many people to break the chain of transmission because it's not that effective to move around. However, the Delta has stepped up the transmissibility, which means instead of needing 70% of the population vaccinated to get that herd immunity, I've seen reports up to 90% of people need to be vaccinated to really quell the lateral transmission. So if you think getting 90% consensus on anything is difficult, so that is what we need to be aiming for. So we've tried to step up. We need to reach every corner of the community. We need to get outreach. We need to understand what's causing hesitation. We need to address it with education. There's all kinds of strategies. One of the provinces is doing a lottery. So if you get your vaccine, you're in for $1 million lottery. Like, these are all tactics to say, how do we get to 90%? And that's what we need. So anything as messengers, as leaders in the community, anything that can be done to support that. It's something we continually work on. And Judith, you've been front and center in Coldwater, rallying people off the streets. So that's the kind of effort we need.
Yep. Okay, thank you.
Oh, go ahead, Mary.
Chairman, with the things that are occurring now, in the last couple of weeks, I've seen a change in some people with their lack of patience and their lack of courtesy. Are you seeing that same spike, particularly when it comes to emergency? I think people are kind of getting the impression that the pressure of COVID is off and other things should be happening quicker and more demanding. Are you seeing that at the hospital, especially in emergency?
Great question, Mayor Hughes. The simple answer is yes. We've seen an increase in all forms of inpatients and behaviors. We've seen an increase in violence causing harm to our staff and lost time injuries directly related to behaviors. That's gone up in the last year. We're seeing more patient relations cases where we need to come in and mediate. Some of it is related to visitation. So we have opened up our visitation. If you qualify for a visitor, it used to be once a week. Now it's once a day to enhance. We really want to see more people visiting. And I think that's one of the things in hospital, people are really hoping to see more improvements. We are so limited by space. A, we don't have an extra empty bed. So we've got people packed into every room, and B, we don't have any space to let the visitors come. So when you get a few visitors at the same time, it becomes unsafe. So those are the elements that we see in hospital, but we also see just general fatigue. People are tired when they get in. They're struggling. They lack the human contact. I will say with the new guidelines, we anticipate, personally, I support July 2nd, no sooner, for a second stage 2 for the province. What I'm really excited about, it opens up outdoor gatherings. And I think that's what we need to be focusing on, because that's safe and people need the connection. So if we can figure out a way to enhance safe connectivity and allow and enable that, Mayor Hughes, I think that'll go a long way in people's behaviors overall.
Jen.
I just had a couple of questions. I also just wanted to comment. I was at the hospital a couple of weeks ago with my son for an emergency. I've actually unfortunately been a couple of times recently, but I mean, not the place you want to be, but at the same time, the staff was wonderful and everybody made us feel very comfortable and very safe and all of those things. So just a thank you, more or less. But just curious, I was able to get one of what I guess you call a leftover dose for the first dose. Is that possible still for second doses, or how does that work?
Yeah. So we'll be publishing, and it's often through the public health unit with the notifications of clinics. There's a variety of reasons why we have, well, we go to great lengths. We don't waste a dose, a drop. We extract extra doses from vials. So we'll do everything we can, and we often have the extra doses. What we're seeing too is people aren't canceling their appointments if they get on a wait list. So then we have no shows, and then every person is accounted for every day. So those are why we have those extra appointments at the end of the day. So I would encourage people to keep on as many wait lists as you can. Now that we can mix and match, it makes Pfizer, Moderna, it doesn't matter which one you're getting. The only difference is age. So if you're between 12 and 17, you need to get the Pfizer. That's the one precaution. Otherwise, mixing and matching is fine. Get on every list, and it's public health that will be posting those updates. We're pretty fully booked in the clinics, but we are seeing some success in the waitlist strategy. And that's a great way. If you've got an appointment down the road and you qualify for your second dose sooner, then the waitlist is a great strategy. And don't forget to cancel.
So yeah, I think it's a great opportunity and to not waste anything. Just to carry on what you were saying about kids, just wondering if there's been any talk about vaccinations for kids younger than 12, or if that's completely like off the table from what you've heard.
I don't have firsthand knowledge of that. I do believe the studies are being done. There's nothing approved, but the studies are being done. And the good news is kids under 12, although they can transmit less likely and definitely less severely ill, but we'll have to wait and see what we typically follow the guidelines from NACI, which is the National Organization Advisory Committee for Immunization.
Thank you.
No problem.
Chairman, one other aspect that has occurred to me is that the other side of COVID, with all the mask wearing and all the precautions, has kept us away from a lot of other things that we normally see. And I'm just concerned that all of a sudden, if all the masks are removed around September, whatever it is, you're going to be not only flooded with making up the backlog, but at the same time, you may get a real surge of the typical things that we've seen.
Yeah, there's an adage I'll reference, kids need to eat dirt to build their immune system. They need to be exposed, and they haven't been. We haven't been as a society. We've gone 16 months of being incredibly sheltered. We had virtually zero influenza last year. That is a very real concern. We just have not had the natural exposure to pathogens, and it's influenza, it's RSV, it's rhinovirus, which causes the cold. So we could have a pretty nasty cold season. We could have a pretty nasty flu season coming our way. So this is where the next round of vaccinations for the flu is going to be very important. And yes, I add that to the list of my worries for the fall. It's a growing list. Judith?
Just a quick back to Jennifer. Jennifer, I had an appointment in August for my second shot, and I went online and I went to the Fitton's pharmacy, and I'm going in Monday. They put me on a wait list, and a day later they called me and said, you can come in.
Yeah.
So I'll take the early and I cancel the other, and away I go. Yeah. So it's amazing that these drug stores, especially the smaller ones, I'm finding, everyone's booking in Shoppers, but there's a little one in Elmvale and a little one up in the mall in Orillia. So I just give you that heads up if anybody asks you.
It's getting easier in some of those drugstores. Some of the changes in the guidelines around the vaccine are making it a bit more accessible. So know your local areas for sure, and wherever you are at, access is pretty good right now. The supply is great. We're getting more and more vaccines, so that shouldn't be the rate limiting step.
Carmine?
Yes, Bill.
Just question. I know everyone has been so focused on COVID these last, like I said, 16 months, and it's kind of overshadowed some of the other things that obviously haven't gone away. For example, the opioid crisis.
Yeah.
I guess there was a report yesterday in the US that overdose deaths were about the same as COVID. Are we seeing, no one hears about it right now because it's all COVID, but what are we seeing?
So public health has those statistics. I haven't seen them recently, but I can say in more of a general sense, we have seen more deaths related to opioid crisis, and people are being found in overdose because there's more drug use happening alone. And not, so when we think about drug use safely in groups, to be able to respond, to be able to administer Narcan, those are really important things. So we have an increasing mental health and addictions problem that's growing through COVID, with more social isolation, which makes the mental health worse, but also makes substance use more dangerous. So that combination is definitely real. We had rounds here, joint rounds with our physicians and OPP, and it really is a struggle trying to get out more Narcan to people, which the uptake has been lower. So there's a variety of factors that's coming in, and on top of that, we do get runs where supplies that are circulating are not, may contain more fentanyl, et cetera, that causes peaks of cases presenting to our emerge. So it is a real problem there, and you're very right. That's one of several sort of non-COVID sequelae, if you will, around more people, to Jennifer's point, more people are getting injured because they're doing more stuff outside, and in doing so, more people, our orthopedic surgeons are telling us, more people are doing home renovations and falling off ladders and breaking their hips because A, you can't find a contractor, and B, you've got time. Oh, I'll do it myself. And it leads to perhaps less qualified, less safe behaviors. So these are all the factors that we're starting to unravel. But the opioid crisis is clearly one of importance, and we are putting some thought behind it. It's just very difficult to get at a problem in the current environment.
Thanks.
Thank you.
Any other questions for Carmine? Okay, we will move along. Up next, Curtis Schluter in for Bruce Stanton.
Thanks, Bill. First, just wanted to start off with regrets from Bruce. Unfortunately, the House is keeping him quite busy this morning, so he wasn't able to make it himself. He did also want me to just pass a quick acknowledgement on the great work the Chamber is doing with their rapid testing initiative for businesses in our area. Great job on that. Bit of a short report today, not a whole lot coming from the federal scene. The House is basically in the process of wrapping up for the summer. They plan on rising on June 23rd, which is next Wednesday. Right now, the government's focusing on getting through some of the sort of high ticket items that they've been trying to get through before we rise. There is sort of a possible election looming in the near future, either later in the summer or the fall potentially. So one of the items that they are trying to focus on getting passed before Wednesday is Bill C-30, which is their budget implementation bill. So that has a lot of effect for a lot of the COVID provisions and business supports that are currently in place. As Bruce mentioned in the last update, there is a plan to start scaling back programs like the wage subsidy and the rent subsidy starting in July. So all of that is sort of conditional on the budget implementation bill being passed. We still don't have a whole lot of details on what the scale back is going to look like, but essentially bank on for businesses that if you are utilizing any of the wage subsidy or rent subsidy supports, that they will start being reduced effective July 4th. With that being said, of course, the government's put in a provision that gives them the ability to essentially ramp those programs back up until November of 2021. Obviously, depending on if we enter a fourth wave scenario or if cases go back up and we do have to go into further lockdowns. Another note for a program that is coming to a close is the Canada Emergency Business Account. So that one, the applications will only be open now till June 30th. After June 30th, that program will no longer be accepting any applications. So if you're a business and you haven't had a chance to apply for that yet, definitely do that before June 30th. like I said, all of these changes are going to be dependent on how quickly the government gets that budget implementation bill passed. But we expect that along with a few other pieces of legislation, will be passed before Wednesday of next week. The House is basically sitting until midnight every night to get through all of these sort of last minute agenda items. One other note for funding in our area, last week, the federal government announced sort of a program with RTO7 to sort of inject some support dollars in for tourist businesses in the area. So right now they announced 1.2 million. There are applications open through RTO7 for funding. So if you're a tourism operator, definitely reach out to RTO7 for those applications to see if you can get any support going into the summer. And then just the final note from Bruce we wanted to touch on was the border reopening. As you may have heard, the provinces are sort of dropping their border restrictions. So between Manitoba and Quebec, we're seeing those borders reopening. The current US-Canada border closure is set to expire, on June 21st. We haven't heard quite yet what is happening. There is immense pressure from the United States to proceed with a full reopening. Canada has sort of taken the stance that they would like to see us hit certain vaccination targets closer to the 70% range before we look at any kind of reopening with the US border. But all indication we're getting from the federal government is that there will be some form of staged reopening at the border. So we might see some restrictions starting to ease as of June 21st, which will likely result in easier travel for anybody leaving Canada to the US or US entering Canada, especially going into sort of the touristy summer season. And then as well with that, we have heard sort of an advisory recommendation from the federal government. So it looks like starting within early July, likely the first week of July, quarantine restrictions for travelers will likely be lifted for those that are fully vaccinated. So if they are fully vaccinated, they will not have to do the 14-day quarantine. For any unvaccinated travelers coming in, they're still going to be held to the same restrictions that are currently in place. That includes the 3-day mandatory hotel stay. The government has been pretty adamant that that will stay in effect, regardless of the restrictions being eased. At this stage, we haven't heard anything differently. So bank on sort of in and around early July, we will start seeing anybody who's vaccinated will be able to sort of go back to normal in terms of travel. Anybody who hasn't been, you will still be sort of held to those restrictions that are in place by the federal government. So that's pretty much it for the update. Very short, like I had mentioned, but if there's any questions, I can definitely take those, or if there's any questions or feedback for Bruce, I can pass those along to him as well.
I have a question.
Yes.
Curtis, if someone's in the States and they get a vaccination down there and they have proof, and that's their second one, that qualifies as fully vaccinated then?
Yeah.
Okay.
Yeah, that'd be correct. I'm not entirely sure in terms of like the federal government hasn't really announced a formal vaccine passport. I know that's something that's been in sort of discussions, especially with like the European Union and the United States. So there's not been a real formal recognition of how countries are going to acknowledge other local health units vaccination receipts, but I'm sure there's going to be some sort of way of figuring out and acknowledging if, for instance, you've gotten your vaccination in a different jurisdiction, that it will be recognized in either another country or in a different health jurisdiction. So
I was just thinking of that when you said if you're fully vaccinated, you don't have to do the 3-day stay in the hotel if you're coming from the States. And I just thought if the person got it down there and they came up, that would probably be considered fully vaccinated.
Yeah. So as long as they have maintained a record of what they received, now sort of the caveat to that as well, and something people should be aware of is that in the United States, for instance, they haven't recognized the AstraZeneca vaccine. So certain venues and locations are not treating AstraZeneca as a vaccine. So for the purposes of if you were trying to go, let's say, for instance, I believe they were talking about Bruce Springsteen on Broadway, you're not going to be able to attend that if you have the AstraZeneca vaccine. But for most other cases, it should be fine for traveling, but the US has been a lot more relaxed on sort of the entry requirements. Canada has obviously been a lot more strict in terms of who is allowed in. Yeah, so it's as long as people have their receipts, they should be fine sort of in the interim. And then I'm certain we'll hear more sort of negotiations between the different countries on what will be sort of recognized as sort of a universal standard for vaccine records.
You're on mute.
Sorry, there we go. You sort of mentioned it there just briefly, but what are we going to need to carry as proof of vaccination?
So
Like
good
papers. I mean, there's
Mhm.
been talk about the vaccine passport and.
Yeah, so in terms of it's difficult because Canada and the US haven't really articulated a plan as of yet, but we're looking sort of to the European Union as sort of like an idea of like what sort of this will look like for other countries. So Europe is implementing, it's almost like a visa type program. So for travelers coming in, they would need to sort of apply in advance and basically demonstrate that they've had a vaccine. So providing a vaccine receipt and by doing so, then they'll be permitted entry with no restrictions. If they don't, likely there's the potential that the country may not let them in, or they may require you to go through quarantine, which will most likely be the case, is you'll just be required to quarantine upon arrival in the country. But we haven't heard anything from Canada, US. We've only heard sort of European Union's plan for the US, which is to basically implement a program where any travelers entering the European Union have to apply in advance and basically show that they've been vaccinated to avoid any sort of restrictions.
Thank you. Sorry, just the AstraZeneca thing, how it's not recognized. What have you mixed and matched? Do you have an idea how that is going to play out?
Not as of yet. Like I said, it's really more so it seems to be on the private business end where it's having the effect. It's not like the government in the United States is saying, no, you can't do this or you can't do that. If you've had AstraZeneca, they just don't, like they haven't approved it. So that could still eventually happen at some point, maybe not, but really it's more the private business end. So venues, like TV shows, like they're not allowing people to enter if they haven't had a recognized vaccine in the United States. So it's harder because it is a private business or venture that's putting that requirement in place, as opposed to sort of it being a government requirement, but they're obviously following their health officials' recommendations on that. So it could change based on if they end up eventually approving AstraZeneca, but at this stage, bank on the assumption that if you're going to a venue or a location in the US, to check to see if they have any requirements on vaccines. And if they do, likely if you've had AstraZeneca one, like, and you've maybe had Pfizer or Moderna as your second, it's a sort of a gray area. I know they're talking about eventually that you can go for booster shots. So potentially maybe your third shot of a booster could be Pfizer, and then technically you've had 2 doses of an approved vaccine. But at this stage, I would say it's still a little early, but it's hard to say exactly what standards are going to be held in the United States, apart from the likely at this stage right now, they're going to follow the FDA and like their federal guidance on vaccines.
Thank you. Any other questions for Curtis? No. Okay, so we'll move along. We received regrets today from Jill Dunlop, but she has sent a video. So I think Erica's got that queued up and we can play that.
Happy Friday, everyone. Thanks to Chamber for allowing me to still send in an update today, even though I can't be with you. As of Wednesday, Ontario reached yet another incredible milestone in the fight against COVID-19, with over 75% of Ontario adults aged 18 and over have received at least 1 dose of a COVID-19 vaccine. So the vaccine rollout continues to make tremendous progress, including over 18% of Ontario adults, which is more than 2 million people, are fully vaccinated. So we are expecting more doses of AstraZeneca from the federal government to arrive this month, and will expand their distribution across the province so that those who want a second dose of AstraZeneca will be able to receive one. with the majority of Ontario adults having received the first dose of the vaccine, providing a strong level of protection from COVID. We are accelerating second dose appointments so that Ontarians can receive maximum protection sooner. Every dose administered brings us closer to ending the pandemic and moving to step 2. And discussions are currently taking place with health officials with considerations of moving to step 2 sooner than July 2nd. Simcoe North has remained diligent with our efforts and following our roadmap to reopen, and I know businesses have made huge sacrifices, but we are moving quickly in the right direction. The roadmap has provided us with a 3-step plan to cautiously and safely open based on the province-wide vaccination rate and improvements in key public health and healthcare indicators. And because of your efforts, we are moving swiftly towards step 2. And I'd like to thank the Chamber for all the work that you have been doing with the rapid test rollout. I've heard from Ramera Chamber, who was very thankful for the efforts you've taken, and you've really, truly been leaders in our area to ensure that businesses are getting those rapid tests. Yesterday, the National Post published Minister McNaughton's op-ed to launch the province's panel to explore the future of work. The committee's mandate is to provide recommendations to position Ontario as the best place in North America to recruit, retain, and reward workers. The committee will lead consultations and deliver reports with recommendations that address the complexities and opportunities caused and/or accelerated by the pandemic, including changes in technology, the growth of work from anywhere employment, and the significance of continuous skills development. The Ministry of Labour, Training and Skills Development also introduced the Building Opportunities in the Skilled Trades Act, which was recently passed. And this is to help tradespeople get their certification from one reliable, streamlined designation through a new Crown agency called Skilled Trades Ontario. So this would replace the Ontario College of Trades. And the legislation will make the province's skilled trades and apprenticeship system more efficient, accessible, and easier to navigate, and make Skilled Trades Ontario the province's industry-informed training authority to lead the promotion, research, and development of the latest training and curriculum standards. The new legislation will allow apprentices and employers to access registration, write exams, obtain certification, and trade equivalency assessments all in one place, with many services offered digitally. These initiatives are part of the government's skilled trade strategy, which includes reducing the stigma related to a trades career and simplifying the apprenticeship system. The Ontario Small Business Grant applications that are still awaiting a response, and we have heard from many in our office and across the riding that they haven't received their response yet, but the ministry is continuing to receive and review review the responses through the ministry, and my staff are working tirelessly to assist with these businesses. I'm hearing of lots of great success stories of some of our businesses that have been patiently waiting to hear if their application was successful. The volume of applications received has been substantial, especially after the second round was announced during Budget 2021. The ministry team has been enhanced in order to work through each application, which I think is really important, that businesses know that this isn't going through a computer system that's keeping some and tossing some out. These are actually people who are going through these applications one at a time. Stats show 110,568 businesses in Ontario have received their first payment, and 91,719 have received their second. So they are continuing to roll out. Another grant application I just wanted to bring to your attention, if you weren't already aware, was the Ontario Tourism and Travel Small Business Support Grant. So it's currently open and runs similar to the previous Ontario Small Business Support Grant by providing one-time payments of $10,000 to $20,000 to eligible small businesses in the tourism and travel sector only. So more information can be found on the provincial website, ontario.ca. And I encourage any business who did not receive the Ontario Small Business Support Grant and operates a tourism or travel business in the area that opened before 2021 and was still in operation on April 30th of 2021 with fewer than 99 employees to apply immediately, as the grant does close June 25th, 21st. And with that, I just want to end by saying we actually have Canada Day signs that are being delivered to my office early next week. If there's anybody who's interested in those, we'd be happy to have them stop by the office and pick them up. And also I wanted us to wish all the dads on the call a happy Father's Day. I hope you have a wonderful, enjoyable, relaxing weekend. Take care, everyone.
So next, let's move to Oromadante and Mayor Hughes.
Hi, I'm going to give a little bit and then I'm going to turn it over to Jennifer to add more to it. One of the things that's happening in terms of recovery is what we're looking towards is that we have a significant number of businesses who are wanting to expand and wanting to locate, and we're turning them away, or they're feeling all kinds of frustrations and being able to do that. That's an issue we've had to deal with in the past, but it's becoming more and more pronounced now. It seems kind of absurd that we're in a situation where after COVID, the economy is looking to recover. Businesses want to expand, businesses want to locate, and yet we've got all of the red tape and all of the other kinds of stuff in the way that prevents them from doing that. And so that is becoming more critical than ever before. We've even had situations where we wanted doctors to be able to locate in the township and no real space for that to happen. So those are the kind of things. The other thing is that a number of businesses are not opening up when they probably could, because the insurance has gone absolutely through the roof. One example is that Big Curve Acres, who normally puts out 150 horses to camps. In those areas, it isn't so much that you don't have some demand for some camps. It's the point is that they told me that their insurance has gone up so much that if they were to open for the summer, they probably would be lucky to break even at covering the extra costs of the insurance. So there's going to be all kinds of, I think, impacts from insurance costs. And I don't know how those insurance costs are related to COVID or whether they're not. That seems to be the issue. The other part of it is that on the ski industry last year was really hit hard in Ontario. And we are really hoping that the ski industry gets to go ahead because 2 years in a row would be absolutely devastating for a lot of that and all the tourism that's connected with it. I go back to businesses because I see us putting all kinds of money, and rightfully so, to try to get the tourist industry going as quickly as we can, but at the same time to not be able to unshackle some of the things that are holding up some of our businesses from being able to locate and progress and move ahead is certainly, I guess, counterproductive to what we need to do. So on the basis of COVID, I see a lot of, when I look at the percentages of vaccination, I believe that Oromadante is leading the troops, let's put it that way, in the number of residents that have gotten at least their first shots. I was fortunate enough to happen by a drugstore just when they had a sign out, and my wife and I both got our second shot, moved up when we were due for August the 1st, and it just happened we were able to get them just simply when we asked. So I would really encourage what's already been said is to keep checking locally for people who are not only looking for second shots, but first shots to be moved up. And so Jen, I'll turn the rest over to you to see what else you might be able to add.
Thank you, Mayor Hughes. Yeah, like you said, we're quite busy with business inquiries. That certainly hasn't slowed down. I would say more or less it's actually picked up. We've actually had a number of tourism related inquiries in the last few weeks that have really picked up. That agritourism component really, key. So ties into a project that we just got approved by council to move forward on a tourism product gap analysis and policy recommendations. So moving forward on that project to tie into our official plan updates so that we can hopefully support more of these businesses going forward. Also the recent announcement from Veta Spa. So that's the new Scandinav type spa that's up on line 3. They're hoping to open their doors in September. So really excited for that opportunity. They still have a lot of work ahead of them. So hopefully things can keep moving forward with that. But would be a great place for all of us to go in the near future to get some relaxation and, treat ourselves. So looking forward to that. Also recently announced was the new farmers market in Oro-Medonte organized through the Chamber of Commerce. The first one kicks off on Canada Day, and that will be at the Oro Fairgrounds. So we're really excited to have this opportunity now in Oro-Medonte. It will be on Thursday afternoons, and bringing a lot of our local producers together to support this market and the local community. So hoping others within the area can come and visit as well. Just as a township, we have a lot going on. Like I said, with business inquiries, our Line 4 Business Park is now online with some properties being available. I think they're still available. It's kind of a hot market. So I have a feeling they're going to go quite quick. And just trying to, help businesses reopen and navigate all the regulations and what they can and can't do. Quails Brewery, for example, just opened yesterday with an expanded patio in their hops garden. So really cool experience there. So just really trying to help the businesses navigate all the regulations and how they can reopen and be creative so that they can, have bigger capacity and welcome more visitors as they're trying to get, as much revenue back as they can. So yeah, thanks.
Thanks, Jennifer. Mayor Hughes, any questions for either of them? Okay, so let's move on next to Romera and Deputy Mayor Joe Go.
Sorry, hit the wrong button. Sorry, Bill, but I'm going to correct you. It's Goff. Okay, our municipal offices have opened now to some inside traffic. I guess if you're coming for any treasury related, you can walk in. Any building passes or planning aspects, it's still by appointment only. I know earlier when I was on the meeting with Alan, just Erica on the screen, I was talking about our waterfront strategy plan that we've put in place, where we've issued parking passes for our residents. We've also offered them to Severn at no cost, and to Rama First Nation at no cost. And we've also offered the option to Orillia to provide a season pass for $50. And we haven't had, we've had a lot of our bylaws. We've hired extra bylaw to try and enforce it, just to control the number of visitors during the stay-at-home order. And I was actually surprised that in the first 3 weeks, we put $12,000 worth of parking tickets into our coffers. So I guess our bylaw officer has been out there really writing a lot of tickets to non-residents. We will be implementing paid parking at a number of our beaches for non-residents through the Honk mobile app. And that should be in place, I guess, starting Monday or Tuesday of next week. That's about it.
Okay, thanks. Any questions for Deputy Mayor Joe Goff? No. Okay, so let's move to Severn and Judith Cox.
Hi. Our office we're scheduling to try to be open on August 3rd, but right now we permit 2 people in the administration building with appointments. We still do the distancing, and we have our steps match the province steps. So for step 1, that's what we do. Step 2, we have an opening, return to service, and step 3 is doors are open. Front barriers are still in place. We aren't sure how we're going to work the washrooms and those types of things. So we're sort of matching the steps that the government takes. We also still are going to, at this time, we still have our 2 teams, A Day, B Day, to make sure that we always have coverage in every department in case COVID did spread. We also have initiated flexible work hours, and so that will be looked at for our staff when they, on August 3rd, there may be some people who want to work early and leave earlier or work at home some days. And that helps us because we have hired more staff and our administration office is pretty full. As far as council goes, we won't be going back to regular meetings for quite a while because our council chambers would only allow maybe 3 council members to be there. So we may do a hybrid method of some at home, some on Zoom, and we are going to start to move to streaming and recorded meetings. We have a farmer's market in Washago that started 2 weeks ago, and it's on Friday afternoons at 2. It's done absolutely wonderfully. There's not, sorry, the Lions Club have put it on. There weren't a lot of vendors, and it's slowly building, but they sold out of everything. Coldwater has one at the mill on Saturday from 9 to 1. And one of our new restaurants in Featherton, the Coldwater Grill, has just finished putting a beautiful outdoor patio up, and it's going to be open this weekend. We do have the same parking thing with Ramera and Orillia. We're noticing a lot of seasonal people are actually permanent people now. They have been at their cottages and they're planning on staying there. And especially once they notified us that the schools wouldn't open, it's even increased more. So last weekend was our first store open weekend. Saturday was busy, Sunday was very quiet. And that's it.
Sorry, Deputy Mayor Joe Gaw. Question?
Yeah, for Judith. Have you heard anything, Judith, about how Centennial Park's going in Washago? Because I know we're supposed to be helping you
Yes.
with bylaw on
I
that.
didn't hear any complaints this past weekend, but I'm now waiting because I think they'll roll it in. Our biggest problem last year was numbers, and I think that the parking passes, it's been put out there very clearly. And I know last year that Lake Country, we would tell everyone that we were open, but now they know we're not, so that may help a bit too. And our boat ramp was absolutely ridiculous. It was very unsafe. People were swimming and fishing and nobody was waiting for anybody. So I'm assuming maybe last weekend and this weekend's not looking lovely. So we may be good until the following weekend, the long weekend. But I was in Washago last Friday to go to the farmer's market at 3:30 and 169 was backed up right from where the liquor store is, right through Washago back into Ramera up to Rammer Road.
Yeah.
So it's back. They're back.
They're back.
Yep. Thank you.
Great. Okay. Thanks, Judith. Let's move on now. We shall go to Lakehead University and Chris Glover. Chris.
Good morning, everyone. Not too much to share other than we're just in about a week away from opening up our classroom and course timetable. So students will be registering for courses in the next week, and our plan still is to head toward a full return for the fall. Now, that being said, there will be a mix of in-person, hybrid, and remote delivery of courses continuing, but we hope to see significant return of students to our campus. We've also started in the last 2 weeks a social media campaign to encourage students, staff, faculty, community members to get vaccinated. So you may have, if you follow us on social media, you may have seen those posts there. So probably at the next meeting, I'll have a better, stronger update in terms of where our numbers are looking for actual in-person delivery on campus. And that's it for me.
Thanks, Chris. Anybody have questions for Chris? Okay. Let's move along to Georgian College, and sitting in this morning for Stephanie Dimmock is Patricia Whittington. Patricia,
Thanks.
and I'd like to offer you a nice warm welcome.
Thank you very much. It seems like a really informative group, and I'm very happy to be here on behalf of Georgian. Some of you may have heard that Steph has been the successful candidate with a new position with Fleming College, and so she is leaving Georgian, unfortunately, as of early July. There is a posting out for the dean position in Orillia, but in the meantime, she asked if I would step in to represent the college. My title is Director of Indigenous Services and Access Programs. And so the scope of that includes supporting Indigenous students and communities, but also programs that support adults in transition to employment and education. Some of the skilled trades things that I think I heard Jill Dunlop mention in her update, supporting individuals who are injured workers, newcomers to Canada. So a broad range of people in our communities who need to get ahead for themselves and to support the economic development of our communities as well, to be those really important workers that our businesses are looking for, and entrepreneurs who will start a new business as well. So I'm actually located in Midland today, which is the traditional land of the Wendat and the Anishinaabe people. And probably like many of you, it's raining outside and my internet is a little bit unstable. So that's why I've had my video turned off, but it's nice to see everyone's faces. So just a few updates from Georgian. We are continuing to see increased enrollment over last year, which is a really good thing because there was really nowhere to go but up. That's both domestic and international. And Chris, you'd probably agree with me that we're all watching the federal immigration policies, what's required provincially for quarantining to make sure that students are well supported who are coming in from out of country. We're not at pre-COVID levels though, and so we're still being very financially responsible. We're encouraging students to be vaccinated and staff to be vaccinated, but it's not something at this stage that it looks like we'll be able to mandate. And so for the fall, we're anticipating remaining, well, we've announced, and the plan is that we will continue as we have been with everything remote where possible, other than where in-class is required. So for some of the healthcare programs and skilled trade programs, as examples, you have to have some hands-on components for those. We're also moving towards a high flex delivery model. So some programs will be almost entirely high flex. What that means is that students will have the option on a daily basis of choosing whether they're in person, coming to campus and attending class, whether they're going to participate synchronously from a remote location, or whether they're going to participate in the class asynchronously, so not at the same time as everybody else, at a time that works for them. So that requires a lot of investment in our faculty and in our technology to be able to make that happen. But what we've seen through COVID is obviously the need of everyone to be really nimble and to respond to changing circumstances, whether it's due to public health or due to other factors. And so this will help our students and graduates to be more nimble when they get out into the labor market. There are a couple things that I want to mention that we've been involved with recently that are real success stories. One of them is the Accelerated PSW Training Program, which many of you have heard about. So this is the provincial government's initiative to train 6,000 new, or just over 6,000 new PSWs, and to absorb the full cost of tuition, as well as paying for placements for these individuals. So the first cohort, which started in April, is getting ready to move out into the labor market, into their placements. And we're looking forward to seeing that positive impact on the communities around us. We also at the Orillia campus, and Steph may have already talked about this previously, but I wanted to highlight it. The Bachelor's of Counseling Psychology, I don't know if she has mentioned that before, but it's a program that was introduced this past fall, and they anticipated having a modest intake of one section. They ended up having to open it up to 2 sections, hugely popular. And over the course of this year, we've negotiated with our Indigenous Services Department and OISE, a matriculation agreement so that there will be some seats funded in the Bachelor's of Counseling Psychology program for Indigenous students who then will be able to move into graduate studies at OISE. So it's a really exciting opportunity and one that we're hoping will be really popular with our Indigenous communities in our catchment area and beyond. Steph might have also mentioned previously as well that the college is investing in equity, diversity, and inclusion work. We've received a grant of nearly $500,000 to do this work. There was a public announcement, I think a month or two ago, and we now have a posting up for a director of EDI. So if you know of anyone who might be a good fit for that, please pass on that posting to them. Let me know if you need access to that posting, or I can share it with the group. We also have a major project going on around digital transformation at the college to rethink how we connect with students and support students, looking at using artificial intelligence as a way of better identifying students at risk, as an example, so that we're able to encourage greater retention. So we'll be making some announcements around that over the next year. As I mentioned, the skilled trades changes will affect the college. We're still waiting for details in terms of what those changes mean, and so that we can connect with employers. So we have lots of connection points with employers, as I'm sure you know, through co-op and placement services, through our graduate placement services, and also through our community employment services that are funded through Employment Ontario. And we're always looking for ways that we can better reach our employer partners and new employers to be supported by some of those programs. So as we get information about skilled trades, I'll bring the information back to this group and how that might affect employers in our area. By the same token, as you're talking to new employers moving into the communities and or employers who are looking to expand, we'd really welcome the opportunity to be part of that conversation as well. So for an example, the spa that's opening up, which is really exciting. I immediately thought, okay, have we connected with our the clinical programs dealing with massage therapy and aesthetics and so on, that might be able to support through student placements or with graduates. And then there's work that we can also do through community employment services to find workers as well. So just really wanting to nurture those partnerships. And then the last thing, actually two more quick things. One is there was an announcement last week now, it's hard to keep track of time, that there is a major transformation for Employment Ontario Employment Services, which is in Orillia, and serving the surrounding area is both Georgian College and, oh my gosh, I've forgotten their name now. They used to be Northern Lights. I'll Google it and I'll let you know, but they're down in the municipal building downtown with Ontario Works and so on. Anyway, so there is going to be a process of going out to find a third party to manage the employment services throughout the area, throughout the region, which includes Simcoe County, Dufferin County, Wellington, and Waterloo. And so that will be happening over the course of the next year. So there could be some changes to the landscape of the employment services that are offered in Simcoe County, including Orillia. And then the last, I'll wrap up with COVID, which is kind of the focus of these talks. We aren't allowed to mandate, at least that's the legal position at this point. We aren't able to mandate that students and staff have vaccinations before they come on campus, but we are certainly encouraging it. And so if there are any campaigns locally that, again, you'd like to tie the college into, please let us know. I'll be flagging Chris Varney, who's our manager of campus safety and security, about some of the discussions that we've had today and some of the questions that are coming up. And I'd be happy to connect you with him if you want to have further conversation.
Hey, thanks, Patricia. I think Carmen has a question.
Yes, thank you very much, Patricia. A question and a comment. One, very intrigued by the PSW accelerated program here at the hospital, but also for some of the community services we have. I might have someone reach out to you or an appropriate person. I just need to check with one of my colleagues to make sure that we are connected. I think it's a great program, and we see the need in the community. It's one of the rate limiting steps actually to getting people back home. Second, just listening to the vaccination process for George, and I'm sure you're aware, but Western took a fairly bold stance in saying you can't come back into residence unless you're doubly vaccinated, or unless you're vaccinated. They didn't say double. I have the child at Western, and I was actually quite pleased to see that. So it is a bold move, and hopefully more do that. And I would strongly consider that for Georgian as well.
Yeah, thanks, Carmine. So my understanding from the Ministry of Colleges and Universities is that they're still studying it and getting their own legal advice. And so until they provide specific direction to the sector, Georgian is taking a more conservative approach, but we're also not opening our doors to everyone. However, residences are open. So yeah, point well taken. Yeah.
Great. We're starting to run a little on time, but Cole, you have a quick question?
Yeah, it was just actually more of a comment, and thank you, Patricia, and welcome, first of all. I've been seeing universities and colleges across Ontario, well, actually more or less my alma mater anyway, are actually offering vaccinations on campus as part of their safe return to class. Is that something that the college is considering?
I'll have to check back with Chris. I know that there are lots of discussions about the strategies to best support a safe return to class. Again, because we're not anticipating being fully reopened for September, it's a little less of a pressing issue for us. I can tell you that our reporting protocols were recently updated because we've had such low transmission rates on campus. We've changed it from faculty need to advise if a student tells them that they have symptoms to faculty only need to advise if a student tells them that they have a positive test. And that's again, just because the transmission on campus has been so incredibly low. I think we've had on campus, we've maybe had 1 or 2 cases that have transferred student to student or staff to student. But I will take that question back to Chris. Would you like me to follow up with you on that, or is it more of a suggestion?
Yeah, and just more of a suggestion. I just noticed I got an email from my university asking if we wanted to book appointments.
Nice.
All right, thanks, Patricia. Look forward to hearing more from you. And we'll move finally, Alan LaFontaine, a quick update.
Thank you very much. Thank you for everybody for updating us. These have been informative. As we move forward to the reopening, we hope that we'll be able to hold one soon of a celebration of getting back to life to normal, or maybe it is during cold and flu season, wearing masks to keep everyone safe and keep workplaces a safe place as well. I'm just going to give an update that if you do go to rapidtestorillia.com, you can order rapid tests. We've given out approximately, facilitated 60,000 rapid tests. We are noticing that it does give some employee and consumer confidence. Of course, if someone does have symptoms, we do ask you to contact Simcoe Muskoka Health Unit to get a PCR test. Big shout out to the United Way and thank you for working with us. We did donate 8,000 non-medical masks so that businesses can give them to their customers to keep their customers safe. Perch Festival, I believe we've got 8 days left on the Perch Festival. If you go to Orillia.com, we are holding a virtual Perch Festival this year. It's as easy as throwing your line out in the water, catching a perch. That goes into the entry form, and still on tap, we do have a Lund fishing boat with a Mercury engine valued at over $30,000. There's thousands of dollars of cash and daily prizes. On our advocacy, we are still pushing hard on Shop Local. We are here for you. If you need to reach out to myself, Cole, or Erica for anything, or President Eklund, we are here for you. We're going to advocate for our local businesses. The biggest issue that we're having right now, I believe, is getting everybody outdoors. Personal care services, please book your first hair appointment. I got to get my hair cut. I can't wait until they do open. And we hope that the province will look at outdoor safe spaces so that we can keep these people in business. They've been locked down the furthest. Great to see everybody out and about now that we have patios open in our area. See you in the patio in Orillia is coming forward, and all throughout Lake Country. Everybody seems to be enjoying the great outdoors. Please shop local. Please support your community, your neighbors. They create the jobs, and please buy Canadian when possible. Back to you, President Eklund.
Thanks, Alan. Any questions there? I guess if not, we'll wrap things up. Everyone can get on with their day. I know I've got a busy one ahead of me, so it's great to see everyone. Thank you for coming out. And the next meeting, Alan, is it next week or every 2 weeks now?
Yeah, I think we when we get to stage 2 opening, we shall have another meeting, and we'll reach out to everybody and let you know when the next one is. Thank you.
Perfect. Thank you. All right. Thanks, everybody. Thanks for coming out. Have a great day.
Thanks for
Take care,
organizing.
everyone.
Take care, everyone. Bye-bye.